Welcome to JH Backcountry Health. I'm Dr. Tyler, and today we're going to be talking about sacroiliac joint pain. It's something I've been seeing quite a bit over the last few months as summer has come to an end. Activities like hiking, running, climbing, biking, golf, and rowing all contribute quite a bit of stress to the sacroiliac joint. It's important before winter comes around and we start skiing and doing all of our fun outdoor activities that we resolve these issues. So the four things that we're going to talk about today are: what is an SI joint? What does a dysfunctional, painful SI joint look like? What can we do at JH Backcountry Health to resolve it? And even include some exercises along the way. So number one, what is the sacroiliac joint? The SI joint is where the ilium, or the wings that hold the ball and socket joint together, tie into the sacrum, which is a small triangular shape at the bottom of the spine formed from about 5 or so fused vertebrae through embryological processes. Now, the sacroiliac joint doesn't move very much. We get about 5 degrees or so of rotation and only about 2 millimeters of translation. The whole point of this joint is to act as both a torque converter and a shock absorber. Essentially, it converts the forces generated by the lower extremities into manageable loads for the lumbar spine. So a lot of times if we see SI joint dysfunction, we'll also find either hip and or low back issues. So now that we understand what the SI joint is, let's break down why it can become dysfunctional and what a painful SI joint looks like. SI joint pain is often misdiagnosed as lumbar spine pain or misinterpreted as such by the patient because it's in such close proximity to the lumbar spine. So if your pain is kind of like general low back, slightly lateral to the spine, it could be SI joint pain. As with lumbar pain and even sciatic nerve pain, we might even get some radiation coming from the SI joint because of the close proximity to the L5 and S1 nerve roots. Now, what can we at JH Backcountry Health do to reduce your SI joint pain? Well, our goal is to help to improve the mobility of those structures and take pressure off the musculature above and below that SI joint. This means many times we're stretching hips, we're getting into glutes, we're working iliopsoas muscle, and we're making sure that we can properly core brace so that we're not irritating that lumbar structure. This looks like some active release technique, some manual adjustments, and then what we like to do at the end of our appointments is actually get you moving. So just like at the end of an appointment, I'll pass it over to our rehab specialist, Ian, to cover the exercises that you'll be seeing.
Hi everyone, Ian here. As Tyler mentioned, we're going to take you through some exercises to stabilize and strengthen the core musculature, as well as make sure that you're getting proper muscle activation in your daily movements, which will help relieve SI joint pain. An important thing to remember with all of these exercises is to do what feels good and avoid doing anything that hurts. If something does hurt when you're doing an exercise, make sure to stop and consult your doctor before proceeding. We'll start with a glute bridge with hip abduction, aka a banded glute bridge. Start lying on your back with your knees bent at approximately 90 degrees and feet flat on the floor. Perform a glute bridge with a resistance band around the thighs, just above the knees. Make sure to draw in the midsection and brace the core in order to press the low back into the ground from the starting position. Engage the glutes to extend the hips upwards until your back, hips, and thighs are in one straight line. Keep the core engaged to prevent arching the back. Press your knees away from one another to resist the inward pull of the band. This will target your lateral hip musculature. Hold for 3 to 5 seconds, lower slowly, and repeat. Next, we'll perform a bridge with hip adduction. This is similar to the previous exercise, but this time place a small ball, yoga block, or other lightweight object between your knees. Perform the same glute bridge with good core and glute engagement, keeping the spine neutral, and squeeze the ball or object together between your knees to hold it there throughout the movement. This will emphasize your inner thigh muscles. Finally, in this set, we'll perform a side bridge or side plank, which is another great exercise to work your core, including the transverse abdominis, obliques, and glute med and min. Start lying on your side on the floor with your feet stacked and place your bottom elbow in a straight line directly below your shoulder. Engage the core and glutes to lift your body into a straight line and hold this position for a few seconds before lowering back down. To make this a bit easier, you can always separate your feet for balance. Next, we're going to perform a posterior lunge, another great exercise that requires more glute activation than a traditional lunge and will help you work on single leg stability and hip stability. Start in a standing position and then step one leg backwards as you kneel down into a lunge, getting as close to touching the back knee to the floor as you feel comfortable with. Make sure to keep your core engaged and trunk upright with a neutral spine. If you can, this is a great one to do in front of a mirror so you can watch that front knee and make sure it is not collapsing inwards. We want that front knee tracking directly over the second or third toe, staying stable and not wobbling around during this movement. Make sure to engage your glutes for stability here. As a regression, you can place your hands on the back of a chair, edge of a sink, or a countertop for stability and support. Next, we have side lying hip abduction. This exercise will target your glute med in the side of your hip, again helping to strengthen your core and muscles surrounding the SI joint that are commonly underactive. Start lying on your side. You can use a pillow under your head or your arm to support your head and neck. From here, make sure the hips are stacked directly on top of one another, and you're going to lift the upper leg slowly before lowering back down. You can have your bottom leg long or bent for extra stability. Push the heel of your upper leg away from you. Keep your legs slightly back, not in front of your body, and toes pointed straight ahead or slightly downward in internal rotation as you go up and down. Make sure to keep the core engaged and prevent the trunk from sagging. You should feel this on the outside of your hip, not in your back. Hold the leg up for 3 to 5 seconds on each repetition for a little extra challenge. Next, we'll target some of the muscles in your lower back, including your spinal erectors, in addition to the rest of your core with a Swiss ball Superman. Begin lying face down with your hips and abdomen on a stability ball. Your feet should be about hip width apart with your heels pointed straight upwards and your hips, knees, and toes all in one line. You can place some dumbbells or a wall behind your feet to prevent sliding backwards. Make sure to keep your head and neck neutral, not extending your neck by looking up. From here, engage your glutes, squeeze your core, and engage your back muscles by pulling your shoulder blades down and back as you raise your arms up behind you. Try to put your shoulder blades into your back pockets and keep squeezing in your core. The progression here is to move your arms out in front of you like you're Superman. Hold the position for 3 to 5 seconds before slowly lowering down, keeping a straight back with head, shoulders, and hips in one straight line. Now let's go through a couple exercises that are great for strengthening the lower back and working on that proper hip hinge movement when bending over to pick something up in daily life. We'll start with the good morning. Stand with your feet hip width apart, put your hands up by your ears, suck in the belly button and engage the core, and then push your butt back as you hinge at the hips to bend forward. Make sure to keep the core engaged and pull the shoulders down and back to keep the chest open and back straight. Keep the knees soft and slightly bent, and focus on hinging at the hips, not bending your back. You should feel a stretch in the hamstrings as you move down. Keep the back straight throughout the movement. If the back starts to round as you bend farther down, stop the motion at the point where you can keep your back straight and work on improving range of motion over time. At the bottom, squeeze your glutes to push your hips forward and stand up straight. Your legs and hips should be the prime mover here to push the ground away, as opposed to pulling from your back. For rehab purposes, I recommend keeping the weight minimal here and focusing on proper form. Finally, the single leg RDL, or Romanian deadlift, is a nice progression from the good morning, which works on the same hip hinge pattern and strengthens the core, glutes, and lower back. Stand on one leg holding a light weight, using your back leg as a kickstand with toes touching the floor, but not bearing any weight in that back leg. Hinge forward at the hips, keeping the core engaged, back straight, and shoulders and hips level. Don't let the hips open up. You should feel a stretch in your hamstrings. Go as low as you can while keeping the spine neutral, meaning you should stop if your back starts to round. From the bottom of the movement, squeeze your glutes to push your hips forward and stand up straight. If you don't have a kettlebell, you can use a dumbbell or other small weight. Keep the loads light and focus on good form. Once you feel confident with this movement, you can lift the back leg off the ground to increase the stability challenge of the exercise. Again, keep the pelvis neutral and hips level.
We hope that you feel better equipped to manage SI joint pain. As always,
See you in the backcountry.